Sectra is all about helping the patients. Now, we have fantastic healthcare in the world today, but that has led to a problem. We now get elderly, we live longer with chronic disease, and unfortunately we have a smaller part of the population supporting that larger group. This demographic imbalance is something that we have to solve. Now, unfortunately, the healthcare IT infrastructure of modern hospitals today does not support that transition. That is still optimized per department and not for the healthcare chain from the very symptoms being discovered until the patient has a successful treatment. To change this transformation, we need a more horizontal approach, and I will show you how we do that at Sectra. This is Sectra's enterprise work lists. Here on the left side, you can see how we have divided the hospital's different departments up in individual workflows. I have selected the Mammography Tumor Board Multidisciplinary Conference meeting. In the work list, I've got 3 patients, and the first one, Anna, has a case history that looks like this. First, a tomosynthesis examination was performed and something suspicious was discovered. They followed this up with an assessment ultrasound. In a multidisciplinary conference like this is typically what you would see in a normal meeting today. The radiologist will drive the show, showing the ultrasound together with the tomosynthesis images. Sectra has also introduced whole slide digital pathology into the picture. So the pathologist and radiologist together can share their views, so integrated diagnostic can take its place. These very high resolution images are able to show with high performance thanks to the Sectra streaming technology. But in an MDT meeting, you do not only have pathologists and radiologists in a breast cancer conference. You will typically also have oncologists and perhaps also the surgeons. To introduce the surgeon's view of things, we have also focused on introducing video streaming into our clients. By skipping into a video, I can skip 30 seconds or 30 minutes into a video file with maintained performance thanks to the streaming technology. Getting these sort of files into the system in the first place is a major challenge. And that is because these files do not come in the standard DICOM format that we have in radiology. And therefore, we do not have any possibility in the transaction protocol to get the patient's clinical metadata linked up with the actual file. Now, for the operating room, we have dedicated solutions, as well as for the endoscopy labs. But I will now show you what we would do in case we had the surgeon asking the hospital photographer to take some pictures before and after surgery, as well as taking a picture of the tumor that was removed from Anna. To get non-DICOM images into the system, imagine that the hospital photographer takes the memory card of the camera and inserts it into the computer. Now, I will start the import window here from within the user interface, but typically that would be done by a launch from the EMR system, populating this study with all the metadata about the patient, such as medical record number, name, healthcare contact ID, etc. I can tag the information with individual keywords or other metadata as well, such as the fact that this is a mastectomy examination or a carcinoma. Secondly, I will browse up the files on my memory card and I can have a look at them in full screen in the user interface. I'm verifying that the quality is fine before I import them. I can also tag the images with individual information based on the role that I have and my department. And then I initiate the import. The import will be done in the background and I can continue working while that is done. And when it finishes, I will see that the import is completed up here. When I refresh the user interface, I will see that the images are available and I can now have a look at them in the system and go through them. And also, even though there are photographic images, I can actually make measurements. But to do that, I will have to calibrate them before that, using a ruler or other known object in the image. And then I can perform a distance measurement, area measurement, or other such measurement, even though it is photographic information. The workflow that we had a look at to import files into the system does have a serious problem. and that is the fact that we rely on the physical memory card of the camera to transfer the images. And for the patient's privacy, that is an issue because you don't need a username and password to log into a memory card. Ideally, we would like to transfer the images from the camera directly to the system without intermediate storage on a memory card at all. To do that, we have direct integration with cameras such as this, with the media transport protocol. And I can take a picture, I'm going to do a selfie here just for the sake of it, and import into the system. And then what happens is that it appears in the user interface. I can verify the quality in full screen, tag it with additional information if I want to, or otherwise just start the import. When it's finished, it's together with the examination, together with all the other images. The integration that we have with this camera can go wireless if I attach a wireless USB cord here. According to Bluetooth, we can get the camera to communicate with the computer. I can walk around in the room, take multiple pictures, and then come back to the computer to do the import. However, sometimes, of course, you don't have access to a computer, or for other reasons, you have to go even more mobile. And then we have integrations with mobile devices such as this iPad. And then I simply log into the user interface with my user credentials, and then I verify the identity of the patient and search up the patient in the system. I can use this zero footprint client to also look at pictures, but now we're going to take a picture. And I will repeat the selfie here and upload this photo. And now this will be uploaded to the patient file and be accessible for all other users in the enterprise that have the user credentials to do so. So that's an example of how we can support the cancer care pathway by ingesting non-DICOM images and videos into the system and allowing everyone, all the users, to access that information for the benefit of the patient. Thank you so much for your attention.